Hello friends. So the upper pink part of your teeth is not doing well. There's some kind of softness or redness that you can notice in your gums, or it is very much painful and sensitive. Your tongue is continuously going in that region and you are finding your food to be spicy. Then friends, this can be the swelling or the gingivitis of the gums. Yes, this pink portion which covers up the teeth are known as gums, and these gums normally are very firm and shiny bright, but once they swell up or once there is redness, they can be a sign of inflammation or infection in that portion. So friends, is your swelling looking something like this? But trust me, even if it is looking like this, that is also called as gingivitis. Yes, even this mild form of infection or inflammation is called as gingivitis, and it can be start of periodontitis. That is the major form of disease which is leading to loosening of teeth, bone loss, and very much difficulties in having food. So all these things, if you don't want, and all these things are not desirable, so if you want to avoid them, avoid your gingivitis at the right stage. Come, in today's video we are going to have a look at this gingivitis and what are the signs, what can be the treatment.
Subscribe to my channel Dr. Mansi Shah for dental related topics.
Hello and a very happy morning to all of you, and here you are on my show Monday Mornings with Mansi and my YouTube channel Dr. Mansi Shah. So friends, as we are speaking about the swelling in the gums, so first let us understand how does this feel to your hand. So this swelling feels very minute puffiness, but your gums, normally if you touch, they are hard. Otherwise, they are soft and puffy. You can easily press them and they'll bounce back. Then the color has changed, that they are becoming more towards reddish color. Then that can be called as swelling. Also, a slight disturbance or a hurt from your toothbrush or your finger or your food can initiate bleeding in that region. Then, yes, these are the signs where you should watch out for gingivitis. So along with it, sometimes you can have bad breath. You can have teeth which are looking much longer because the gums have gone down. Or you can have teeth which are swollen up and the teeth sizes become shorter. So these are both the pictures where I'm showing. So in this first picture, because of the swelling, the teeth has hide up and the size of the tooth is reduced, whereas in this case, because there has been a little bit of bone loss or the gums have been reacted in different way, the teeth are looking much longer. Yes. So what can lead to this kind of swellings? So what are the causes of this kind of swellings? The most common cause for this is the plaque. Plaque is nothing but a yellowish buildup which is formed on your tooth. It can sometimes be hard, which is then called as calculus. So if your teeth has something like this build up on your tooth, then it is called as plaque. And this plaque is formed because of improper brushing, not maintaining proper oral hygiene. Then there are times where your brush is not able to reach that particular tooth because they are crowded. So this plaque formation then irritates your gums and your gums become swollen. So once the gums start irritating or showing some reaction, within some days they'll start bleeding and swelling up. One of the major cause is this plaque. The next cause is some nutritional deficiencies like vitamin A or vitamin C, especially vitamin C, in which we commonly call it as scurvy, in which there is bleeding and swelling of the gums. So why does this happen is because these vitamins are very much important in the formation of collagen and the fibers which are present in your gums. So to strengthen them up, these vitamins are very much important. So vitamin A, C and K, if there is sufficient amount, your gums are going to be in a good state and they're going to be firm there. Then at many times hormonal changes in females or even pregnancy can lead to such kind of changes in the gums. It is very common, and once your hormones get settled out, this swellings also mostly settle in. But in these conditions, when your hormones are disturbed or you're having pregnancy, maintaining good hygiene is gonna help it to cure in a much better way. Then at times, if you are allergic or sensitive to certain oral healthcare products like mouthwashes, toothpaste, if you're trying some new product, then also your mouth can show this kind of reactions. But it will always be seen that it is not only the gums but also the mucosa, the inner lining of the cheeks will also show same kind of reactions if it is specific to some allergens or to some product. So if it is that, you should avoid or stop that you're using that product immediately. Then the next is medications. Yes, if you are suffering from blood pressures and diabetes, then at times it is seen that you will show some side effects or you will have resistance to certain kind of medications. So to that kind of medications, your body might just show swelling in the gums. Stoppage of medicines is going to immediately settle this kind of swelling out. So now coming to the treatment part, the most important thing that you should do is visit a dentist and get your plaque out from your tooth. Yes, once there is plaque or calculus formed on your teeth, you cannot only take care of it by brushing at home. You need to have a professional cleaning treatment in which ultrasounds, that is vibrations, through vibrations of a machine, this plaque is just got rid of. And once that is done with good amount of with certain medications, you can have this swelling settled down. And once that is done, you can have a maintenance period, that is by brushing every day twice, in the morning and at night. It is very much important that if you have severe swelling, you use a mild soft bristles toothbrush. If you don't have much severe swelling and you don't have bleeding, then you can have a medium hardness bristles toothbrush. You can use that. Also, if you are having specific sensitivity, then Sensodyne or anti-sensitivity toothpaste can be used. Then friends, the next is flossing. It is very much important that in between cleaning of your teeth is done, because your food lodgement won't happen and the plaque again won't come back. So cleaning in between your teeth with the help of a floss or a flosser is very much important. Using a mouthwash, appropriate use of mouthwash post a professional treatment and after advice of your dentist is very much important. At least for 2 months you should do this regularly and then slowly reduce it to two times per week. Also, if your dentist is recommending it to continue using it, then you should definitely do that. Then increase your vitamin A, C and K intake. You can find this vitamins in this list. This is the list of food items that you can have to have good health of your gums. An at-home remedy to take care of your swelling or in general of your gums, you can have warm water plus salt rinses at least 2 to 3 times in a day, and that will help you your swelling to subside and soothe your gums in a much better way. Also, at times your dentist might suggest you some ointments if there is pain in the gums, so that will be taken care of. So this was it, and yes, you should always remember that this kind of swellings are always between the teeth and the gum region. So at the tip you will always find this kinds of swellings, and this is majorly because of some irritant or some internal changes in the body. So do not neglect the health of your gums and make sure you keep your gums in a much healthier state, because remember, they are holding your teeth in the position. If their health is not maintained, your teeth might just wobble up. And that is going to have you difficulties in eating, drinking and socializing. So wishing you all a very happy and a healthy smile. Liking my videos, do definitely press a thumbs up, share it among your friends and comment here if you have any questions related to your oral hygiene. Do visit my Instagram page Dr. Mansi Shah and you can find a lot of information there also. Also subscribe to my YouTube channel Dr. Mansi Shah. Feel free to ask any kinds of oral health related questions and I will be very much happy to answer them. Hope you have a great smile and a great day ahead. Stay healthy, stay happy, stay over fit. Thank you.